So my name is Ann Pittier. I'm a radiation oncologist in Tacoma. And probably like many of you, when I started out in practice, I had a lot of questions about nutrition from my patients, and I was actually very ill at ease in answering them. And that is because I didn't get a lot of training in nutrition in my years of residency. And I actually had done 2 residencies, one in internal medicine and one in radiation oncology. So when I started out, I went to the literature and started researching what there was out there in terms of the evidence. And what I found was that it is very clear. And this impacted not only how I eat and how I feed my family, but also how I speak to my patients about what they can do to improve their health. Now, when we're talking about breast cancer, only about 5 to 10% of breast cancer is associated with genetics. The remainder of breast cancer is associated with risk factors, including, of course, gender, age, breastfeeding, alcohol, smoking, but quite a few risk factors are associated with diet. In fact, they are now saying that about 50% of breast cancer risk is associated with diet. And I think that this is an important topic for all of us because we're all going to have breast cancer survivors on our patient panels. As of March of this year, there are 3.1 million survivors in this country. And so we should all be on the same page with how we're speaking to them about nutrition. So what increases risk of cancer also increases risk of recurrence. We have lots of studies, actually, that have shown that there is a correlation between dietary fat and breast cancer risk. We have the Nurse Health study that looked at this. We also, of course, have heard about the Adventist Health study, too, which actually showed that vegan women in particular reduce their risk of cancers in general by 34%. Harvard does a lot of public health studies, and they came out and said even 1 serving of red meat a day in your adolescence will increase risk of breast cancer, premenopausal breast cancer, that's the more dangerous kind, by 22%. The women who continue to eat red meat in adulthood increase their risk overall 13%. So when I'm talking to my patients, I talk to them about both diet and exercise. So this is an interesting prospective study, and it really showed that when you're looking at patients with breast cancer, we do separate them into 2 groups because if our patients are obese and they have breast cancer, we know that they're going to do a lot worse for multiple reasons. And when you look at this, you can see that the women who are not consuming a lot of fruits and vegetables, that first, this one here, the standard American who's not exercising and not eating a lot of fruit and vegetables, they do the worst. When we want to actually just look at what happens when we add physical activity alone, that benefits our obese population slightly. But if you talk to your patient just about fruit and vegetables and not exercise, it goes right back to the very first group in terms of mortality. But when you combine the 2 for various reasons, we know that you can cut their mortality risk in half at 10 years. So obesity is an established risk factor for breast cancer, not only before you're diagnosed, but if you become overweight and obese after your diagnosis, you do worse. So mortality from breast cancer is 35% higher in obese women. And we have lots of reasons for this. Estrogen, the aromatization of androgens in adipose tissue contributes to the estrogen load in the body, which feeds breast cancer. And we also know that cholesterol actually impacts a lot of the molecular pathways that promote cancer. Hyperinsulinemia, we can think of that as a growth factor, and then suboptimal treatment. So women with breast cancer, oftentimes who are obese, oftentimes are underdosed in terms of chemotherapy, and they develop obesity-related complications during treatment, which can impact the amount of chemotherapy or other medications that they can take. And of course, they're the competing comorbidities associated, such as coronary artery disease, which contributes to overall mortality. So when we're talking to a woman and we are thinking about what's the best advice to give, we all saw this slide in a different format earlier. We know that as you add animal products to a diet, the body mass index actually really starts increasing to the average non-vegetarian with the highest, a body mass index of 28. So cholesterol impacts breast cancer incidence and outcome. There is a very clear link. The cholesterol influences the biophysical properties of the cell membrane, which influences signaling events in the cell, promotes metastases, promotes growth of the tumor. And even if we just look at dietary cholesterol alone, we have studies going back that have seen that an increase in dietary cholesterol increases tumor latency, growth rate, and tumor burden. There's a very interesting metabolite now that is being studied called 27HC. And you can see here the enzyme CYP27A1, which is found in the liver, in macrophages, and in tumor cells, converts cholesterol to 27HC. And this metabolite strongly affects breast cancer. It works actually as an agonist at the estrogen receptor. So we have lots of evidence that has demonstrated that high cholesterol levels increase your breast cancer risk. So one of the largest studies was one out of Korea, 1.2 million participants. They followed patients for 14 years, and they controlled for all the bad habits: alcohol, smoking, high body mass index, exercise, hypertension, and diabetes. And there was a 17% increased risk for breast cancer if the cholesterol was 240 or greater. A Canadian study demonstrated similar findings. What they did was they really looked at the women who had the highest quartile of cholesterol consumption. And remember, cholesterol only comes from animal products. And they found that those women increased their risk of breast cancer by 48%. When I think of breast cancer, I think of a cell that's really taking up a lot of cholesterol. Most of my patients come to me and they ask me, well, I shouldn't be eating any sugar, right? I'm not quite sure where they're coming up with that, but there must be something out there that I haven't seen that's really linking that. But cholesterol, we know, in dividing cells is taken up much more by these cancer cells. So even in a regular cell in S phase, we know that it doubles the cholesterol level. And this is important because the cell membrane is forming these cholesterol-rich rafts, and that's the area where there's transduction of the signaling pathways that helps protect the cancer cell from apoptosis and facilitates migration and invasion. And again, we have this cholesterol metabolite 27HC, which acts as a very strong estrogen receptor agonist, more powerful than estradiol. So this year, Big 198 came out, and this is a double-blind, prospective, randomized controlled trial, and they looked at women with estrogen receptor positive breast cancer. And knowing that cholesterol really impacts breast cancer, they wanted to know, well, what would happen if we give these women cholesterol-lowering medications in conjunction with their endocrine therapy? And what they found was interesting. So the patients who were on a cholesterol-lowering medication, a statin, at baseline, they had better tumor characteristics. So they had a lower stage at diagnosis. Also, the women who were initiated on a cholesterol-lowering medication improved their disease-free survival, lowered recurrence, and lowered distant metastases on the order of 17 to 19%. So there have been other studies, and some of these studies have had mixed results. we know that statins have been found to increase intratumoral cholesterol production. It only really works out in the bloodstream. So the statins are pushing cholesterol into the cancer cell where this metabolite is being formed and is a strong promoter of growth and metastasis. And we also know that statins don't decrease the intratumoral production of that 27-HC metabolite. So the real target that the pharmaceutical companies are looking at is that enzyme that I was talking about, the CYP27A1. Even if we could treat everybody with a cholesterol-lowering medication, actually the literature shows us that that about 30% of women won't take it, and that's because it costs a lot of money and because it produces side effects, so muscle pain, fatigue, weakness, and then some of the more rare side effects, rhabdomyolysis, liver damage. So when we're thinking about all of this, we're thinking about cholesterol coming in, cancer really utilizing the cholesterol, and the implication of cholesterol-lowering medications perhaps helping, but perhaps missing some of the target. We should be thinking about a plant-based diet. We know that in the Ornish trial that you can lower your LDL and cholesterol on the order of 30%. So we can look at the standard American diet versus the vegan diet, and total cholesterol and LDL are much lower. Another important mediator for breast cancer is insulin-like growth factor 1. You can't open a cancer journal currently and not read about this every single time. So IGF-1, as you may recall, is very important in development. We make this. It increases during adolescence, and then it falls off as we've reached our growth. It's also important for the development and function and maintenance of a normal mammary gland. But what we know is that in our diet, we are artificially increasing our insulin-like growth factor 1, and we also know that breast cancer cells overexpress insulin-like growth factor 1, and insulin-like growth factor 1 is a potent mitogen. So there is no question. Insulin-like growth factor 1 has a very established role in breast cancer development, progression, and metastases. High circulating levels have been positively correlated with poor prognosis and mortality. And insulin-like growth factor 1, in terms of the cancer cell, increases growth, proliferation. It stimulates angiogenesis and metastasis, reduces apoptosis, and stimulates estrogen to be made, as well as the receptors for the estrogen. It's also interestingly been found to lead to resistance of chemotherapeutic agents. So, of course, the pharmaceutical companies are looking to target insulin-like growth factor 1 receptors, but this has been challenging. And we haven't come up with a target for this yet, but we do know that we can control how much insulin-like growth factor 1 we have in our body. And we know that dairy, seafood, poultry, red meat, all of this and of course processed foods, increases insulin-like growth factor 1 in our body. We can reduce it as well. Exercise, vegetables, legumes, and the beta carotenes have all been shown to reduce the insulin-like growth factor 1. And when we look at various dietary patterns and habits, we know that meat eaters actually have the highest level of this circulating in their blood. If you were to look at a distance runner, a marathon runner, they do decrease their insulin-like growth factor 1. But even the lazy vegans have the lowest level. So we've known for many years that dairy is associated with breast cancer, and we always thought that this is because dairy is chock full of hormones. Now, the newest studies are really coming out showing that, yes, high dairy intake does increase your risk for breast cancer, but it actually, with the estrogen receptor breast cancer, but it actually even increases your risk for the estrogen receptor negative breast cancer even more than the estrogen receptor positive. And this, again, is associated with that insulin-like growth factor 1, as well as other growth factors that are naturally produced in dairy. So animal products have also been shown to reduce sex hormone binding globulin. So when you reduce the sex hormone binding globulin, you are increasing the bioavailability of estrogen to act at the cancer cell. So you're bringing that up. Also, dairy increases estradiol by a considerable amount, 15%. Now, thankfully, this was already brought up. I don't have a patient that doesn't come in and ask about soy. I heard I can't eat soy. Now, this dirty rumor started about 20 years ago. We knew that endogenous estrogen was linked to breast cancer. And then we looked at soy foods and we said, oh gosh, they're rich in isoflavones, and that's a natural, that's a phytoestrogen. And to make matters worse, there was a rat study that found that when these rats started eating soy products, that it did cause mammary tumor growth. So everybody, even I, was saying, don't touch that soy. We don't know yet what's going on, but now we actually have the evidence. We have evidence-based literature to direct our conversation. And what we know about isoflavones is that they do activate estrogen receptors with far less potency. So when they bind with the receptor, it actually downregulates what's potentially the estrogen would be contributing. So it's competing with the estrogen in the body for those estrogen receptors. It increases the synthesis of the steroid hormone binding globulin. So this is reverse of what I just said. If you have more of this binding globulin in your blood, there's less estrogen that's available to those cancer cells. It also increases the clearance of those steroids from circulation. The other effects of the isoflavones include inhibiting DNA topoisomerase 2, which stops the DNA replication, inhibiting angiogenesis, inducing apoptosis, and enhancing your immune system. So I think one of the first studies was the Shanghai breast cancer study, and this found that just with one serving of soy a day, and this includes soy milk, tofu, that it actually was not only safe, it lowered risk of recurrence and mortality on the order of 30%. And this actually was true for both the estrogen receptor positive and negative cancers. Kaiser Permanente confirmed this and added that not only did it reduce recurrence rates, it didn't interfere with tamoxifen because that became an issue. So, cancer doctors love to look for reasons not to believe the evidence at first. And so they said, well, maybe this is true only for the women in Shanghai. And so we did more studies, and we pooled the studies, and we looked at women in the United States, and we looked at Asian women, and we looked at non-Asian women, and we found the same thing. A serving of soy a day reduced risk of recurrence and mortality on the order of 30%. So we then had to have a meta-analysis, and that looked at 5 cohort studies, and they all showed the same thing, 30% reduction of mortality and recurrence, both protective in the pre- and postmenopausal setting and protective for estrogen receptor and negative breast cancer. So we have a broad body of data that demonstrates how protective plant foods are. And we know that the phytonutrients, phytochemicals from plants, inactivate carcinogens. They facilitate the repair of DNA. So if you have those mutations that have occurred, that the DNA repair mechanisms are more likely to function well. It promotes apoptosis, inhibits metastasis, inhibits angiogenesis, of course is antioxidant in nature, anti-inflammatory. And then we can take that, we can put that aside, and we can say, the fiber from all of these plants, and remember, there's no fiber from meat and dairy. It really only comes from the plant products. What fiber does is it really pulls water into the intestines, it increases transit time, it dilutes out those carcinogens, and there is also a path where the bile acids bind to estrogen, and if that's not pulled out fast enough with transit time, which fiber promotes, it will actually be reabsorbed. So there's some interesting data that shows that women who are constipated have a higher risk of breast cancer. And the thought is that more estrogen is being reabsorbed into their system and putting them at higher risk. So the impact of animal products on breast cancer can be looked at in several ways. Body mass index increases the chance of mortality. So when we're talking to our patients, we want to give them the advice of what's going to actually promote weight loss and prevent weight drift from occurring. We know that a plant-based diet has the lowest levels of saturated fat and cholesterol, which is directly associated with breast cancer promotion. And we also know that when you consume a vegan diet, you're reducing the insulin-like growth factor 1, which promotes development, progression, and invasion of breast cancer. And even if you took all that aside, when we talk about our survivors, we talk about them being at a pretty high likelihood of dying from coronary artery disease. So we get them through all this treatment, and then they have a cardiac event. And we've already heard that a whole food plant-based diet can really reduce the risk of developing that disease. So I have lots of literature from my patients to consider. I would also consider all the doctors looking at some of these things. One of my favorite websites is nutritionfacts.org. If you haven't heard of it, you should. You should sign up for the daily topic. It's a 5-minute video where Dr. Greger brings in the evidence-based facts on a topic. It's not all on cancer. In fact, it's mostly on other, oftentimes obscure issues, but it's pretty powerful. Dr. Greger also wrote the book, How Not to Die, and it's a very good read. I'm not sure if anybody else has read it. I was surprised not to see it out here. It's a good book. And I tell all of my patients that Forks Over Knives is a documentary that's free on Netflix, and they should watch it, and they should watch it every 6 months, because you bring. You gain a little extra information each time you watch it. So anyway, it's been a long night. Thank you for bearing with me.